Like so many baby boomers, Warren Buck has tried to keep his body moving. Hiking, sailing, skiing, and gardening.
I've been active all my life, and so I was really very fit.
But then, just a few years ago,
Suddenly I felt it was hard to move. I realized I wasn't moving as well as I used to.
that's when Warren went in to see Dr. Navin Fernando.
Well, before the surgery, I couldn't walk upstairs like this.
So the trend is definitely of exponential growth of patients choosing to have hip and knee replacements. All right, hey,
Dr.
Warren.
Fernando.
Good to see you. But the highest increase in patients choosing to have joint replacements are patients in their 50s and 60s.
Warren's since had 2 hip replacement surgeries that have put him back in motion. His only regret was wishing he'd known about this option earlier.
I can now do things that I used to do. My body feels new. I mean, it's almost like it really is like a new person. I feel at least 20, 25 years younger. And emotionally, I feel brighter. I feel more balanced. I feel more alive.
From the UW Medicine newsroom in Seattle, I'm Katie Chen.